I'm Jennifer. I'm from the Acute Therapies Department. We're going to be talking about sternal precautions and early mobilization with patients today. So we have our patient here. The first thing we like to do when we're working with a patient with sternal precautions is orienting them to their post-op book here. So it's on page 48. There are some activity guidelines, including sternal precautions, that specifically state not to lift, push, pull, or carry anything weighing more than 10 pounds for about 8 weeks. Other than that, we want people in general to be using their arms to help them mobilize. So in terms of bed mobility, we're going to start here in supine. We use the heart pillow for rolling, sometimes and sometimes not. In general, we want to make sure that people are keeping their shoulders, hips, and knees pointing straight ahead. So sometimes we give them a cue of thinking about having lights on the front of their shoulders, hips, and knees. Keep your lights pointing the same direction. Okay, so we're going to demonstrate this with the heart pillow. So it goes over the front of the chest. All right, we're going to bend the knees here. And then in terms of helping to roll, we want to hold on behind the hip and behind the shoulder to help roll. We don't want the patient to be reaching for the rail and pulling on their arm. So have them hold on to the pillow. We're going to hold on behind the shoulder and the hip here and roll. And then from here, we're going to be asking the patient to drop their legs off the side of the bed and then also push up with their arms. Then they can push up with an arm, their underarm going this way. They can also do a combination where they have a hand here and push up with both arms in order to get up. So I'm going to have you put one hand down. Yeah, keep your elbow here. Put this arm down. We're going to bring your legs forward off the edge of the bed. And on 3, we're going to push up. 1, 2, 3. And up we go. Okay. From here, we're going to use a gait belt to help mobilize them out of the bed to the chair. Sometimes we keep the heart pillow over the top of their chest, so then they have their heart pillow with them. If they need to cough or anything like that, it's already available. Some patients find it's more comfortable to have the compression of the gait belt and the pillow on the front, but it's not necessary. You can do this without the heart pillow as well. If you don't keep the heart pillow in place under the gait belt, you want to make sure it's within arm's reach. If they have any coughing, they'll need to splint for their cough. Okay. And in terms of standing up, we always want people to push with at least one hand from the bed. And you can use one hand on the walker. Go ahead. One hand on the bed, one hand on the walker, or 2 hands on the bed. Either is fine. Okay, so on 3, we're going to lean forward and stand up. And that happens too. We have to readjust. Let's remove sometimes. Okay, ready to push up? Okay, so on 3. 1, 2, 3. Good. And then hang on to the walker, and then we're going to pivot to the chair. So we're going to have you turn this direction. Good, and then we're going to take a few steps backwards towards the chair. Okay, good. Feel the chair in the back of the legs. Good. And then same thing here, you can reach back with one hand or with both hands in order to safely lower down into the chair. And coming on down. Okay, good. And then with getting back up, if they're allowed to push with both hands from the armrest of the chair, and we want them just to push lightly, but they're able to use both hands. So we'll have you do that too. Let's scoot forward. And let's push up with both hands here on the armrest. On 3, we're going to stand up. 1, 2, 3. Good, and then transition back to the walker there. This pillow is slightly moving around so much because it's got plastic over it. You just won't have that in real life here. Okay. Okay, good. patient sits, it's easier to get the bed in a lowest position that you can and have them sit far back. So we're just going to ask you to sit far back when you do that. So back up till you feel the bed, and then reach back with one hand or both hands, either way. You're going to lean forward and sit. Good. And then from here, we're doing kind of an opposite getting back into bed as we did with getting out. So we're going to take the gate belt off before we lay down. All right, you've got your heart pillow there. So coming back in, again, think about your lights and think about keeping your shoulders, hips, and knees facing the same direction all the time. So we want to make sure the patients are rolling in on their side and not kind of side back. We don't want them kind of throwing themselves back in. They should come all the way onto their side. Once they're on their side with their legs on the bed as well, their feet are up, then we can roll as a unit onto the back. Okay, ready? All right, so as you come down, you're going to put some weight on this shoulder, okay? So you're going to come down this way and lift your legs up. And we're going to keep our back straight as we're helping. There we go. And once you're here all the way on your side, we're ready to roll onto your back. So I'm going to help with the knees and help with the hand here on the back of the shoulder to help ease them over. Here we go. Good. And then go ahead and bring your legs down.